Prime Minister Narendra Modi speaks to Assam Chief Minister Sarbananda Sonowal over flood situation, COVID-19 and Baghjan oil well fire scenario. PM assures all support to the state. Delhi receives heavy rainfall. IMD predicts thunderstorm with rain in the national capital and neighbouring areas till 21st of July. Flood situation remains grim as all major rivers in Bihar flow above the danger mark. Three-member Central Health team reaches Bihar to review status of corona epidemic in the state. India's focus on early case detection and saving lives to COVID-19 through tracking and testing. 11 most COVID-19 affected countries together reported 8 times more cases and deaths than India. Over 6,77,000 COVID-19 patients in India recover. Active cases stand at 3,73,000. Arunachal Pradesh government extends lockdown in capital Itanagar region till 3rd August. Courts rapidly adopt digital tech amidst COVID-19 pandemic. Union Law and Communications and IT Minister Ravi Shankar Prasad says High Courts heard 1,75,000 cases and subordinate courts 7,34,000 cases virtually. Supreme Court also conducted 7,800 cases. Coronavirus cases across the world continue to spiral with over 1,42 lakh confirmed cases. Global recoveries rise to over 79,83,000 with over 6 lakh fatalities. Worst affected United States reports over 70,000 cases in the last 24 hours. 41 out of 50 American states see surge in cases. And Arsenal blank Manchester City 2-0 to reach FA Cup final. Will meet the winner of the second semi-final between Chelsea and Manchester United later tonight. Hello and welcome once again in our top story. With little respite from the downpour in the past 2 to 3 days, a slight improvement was witnessed in the overall flood situation in Assam. Over 27,50,000 people are still affected by flood waters in 2,678 villages in 26 districts of the state. The death toll due to floods touched 79 as 3 more people lost their lives in the last 24 hours. Even landslides have claimed a few lives and the total death toll has touched 105. In Dhubri district, 4,69,265 people have been affected, the highest among all districts, followed by Goalpara, Borpeta and Morigaon. 47,465 people are still taking shelter at 290 relief camps across the state. Prime Minister Narendra Modi today spoke to the Chief Minister of Assam, Sarbananda Sonowal, and took stock of the situation. In a tweet, CM Sonowal informed that Honorable Prime Minister Shri Narendra Modi ji took stock of the contemporary situation regarding Assam floods 2020, COVID-19 and Baghjan oil well fire scenario over phone this morning. Expressing his concern and solidarity with the people, the PM assured all support to the state. And in Bihar, the flood situation remains critical as all major rivers in the state are still in spate. Buri Gandak River has inundated a village in Muzaffarpur. Over 2,92,000 people in 8 districts are flood affected. Over 11,000 people have been evacuated from the marooned areas. 7 relief camps have been established in which more than 2,000 people are sheltered. 27 relief camps are being run to provide cooked food to around 20,000 flood affected people. Many of them are sheltered in embankments. According to the IMD, Bihar will witness heavy rains till the 21st of July. The national capital woke up to heavy rains this morning as showers lashed the Noida, national capital, Gurgaon and other NCR regions. Rains that started in the wee hours turned into intense spells, leading to waterlogging and traffic jams in several areas. Areas like Minto Bridge, ITO, Wazirpur, Mulchand and Hanuman Road witnessed waterlogging. Meanwhile, the Met Department has predicted thunderstorm with more rain in the national capital and adjoining areas till Tuesday. Despite the early arrival of monsoon in Delhi, the rains have remained subdued. According to the IMD, the Safdarjung Observatory has recorded 47.9 millimeters of rain in July so far, which is 56% less than the normal of 109.4 millimeters. The Met Department has also predicted continuous rainfall for the next 3 to 4 days in adjoining states of Punjab and Haryana as a monsoon trough will move north. Uttar Pradesh will also witness heavy rainfall till the 21st of July. In the south, meanwhile, strong winds are very likely to hit Karnataka, Kerala coast and Lakshadweep area. Fishermen are advised not to venture into the sea in these areas. And in Uttarakhand, overnight heavy rainfall was witnessed in Munsiari, leading to overflow of Gori river. Some houses were damaged and livestock washed away in Chori Bagar. Local administration has said that efforts are being made to restore movement on roads which are damaged. The Met Department has issued an orange category warning for Uttarakhand on the 19th, 20th and 21st of July. An orange category warning indicates that disaster management and local authorities should prepare for disaster control. And mosquito-borne diseases are common during this season. Our correspondent Kiran Bharadwaj spoke to Dr. Soumya Tiwari about how to prevent children from mosquitoes.
Humid weather and the rainwater puddles around create ideal conditions for the mosquitoes to breed. How to prevent children from mosquitoes? To talk about this, we have Dr. Soumya Tiwari. Dr. Soumya, welcome. What can be done to keep the children safe from mosquitoes?
Parents should keep the children indoor, make them wear full clothes, and especially comfortable clothes, light colored clothes, because dark colored clothes tend to attract mosquitoes more. Mosquito nets should be used when kids are sleeping. And the other thing is that one should try and keep the indoors as well as the surroundings clean. The empty containers, pots which are filled with rainwater attract mosquitoes and become breeding spots. So one should try and avoid puddles, avoid empty containers and pots, etc. So regular cleaning should be done.
Fever is quite a common symptom in all the mosquito-borne diseases, dengue, malaria and chikungunya. If a child is suffering from fever, what should be the proper management?
If the child has fever, do not attempt self-medication. Always seek experts' advice. So go and consult your doctor. Even for a mild fever, do not attempt self-medication. What the parents can do while they're taking the child to the hospital is that they can undress the child, especially if the child has high fever, undress him or her and sponge the whole body with water, normal water, tap water at normal temperature. Paracetamol is a safe drug which can be used, but it should be used with the doctor's advice only.
Do not allow water to stagnate in and around your house. Get the doors and windows screened. Keep your surroundings clean and take precautions to prevent mosquito-borne diseases in children. Kiran Bharadwaj, BD News.
And with Bihar seeing a spike in the number of COVID-19 cases, a 3-member team of experts from Delhi is in the state to take stock of the situation. The Union Health Ministry's multidisciplinary team, headed by its Joint Secretary Love Agarwal, is reviewing and coordinating with the State Health Department in managing the outbreak in the state. The team will provide necessary support and guidance after reviewing the situation. Director of the National Center for Disease Control, Dr. S.K. Singh, and AIIMS New Delhi Medicine Department Associate Professor Dr. Neeraj Nischal are the other two members of the central team. The recent spurt also necessitated re-imposition of a complete lockdown till the 31st of July. And while it is true that COVID-19 cases are rising in India, the focus is on early case detection and saving lives. The 11 most COVID-19 affected countries in the world, including the United States, Brazil, Russia, Peru, Chile, Mexico, South Africa, UK, Iran, Pakistan, Spain together reported 8 times more cases and 14 times more deaths than India. The focus of containment strategy remains on house-to-house survey, perimeter control activities, timely contact tracing, surveillance of containment and buffer zones aided by effective clinical management of severe cases through a standard of care approach. Continuously expanding hospital infrastructure has aided in increased recoveries. The latest testing strategy of ICMR allows all registered medical practitioners to recommend testing. According to the Indian Council of Medical Research, 1,37,91,869 samples were tested for COVID-19, of which 3,58,127 were tested just yesterday. Meanwhile, the actual load of cases or active cases stands at 3,73,379. Most of those infected have recovered. The recovery rate has been improving at a good pace. It stands at 62.86%. Medical attention is being provided to all active cases either in home isolation or in hospitals for severe cases. The number of recovered cases has further increased to 6,77,422. The difference between recovered and active cases is progressively growing. It stands at 3,04,043 today. 26,816 patients have died due to COVID so far. And the battle against COVID-19 has reached a crucial stage in India as human trials of the Indian vaccine are underway. The All India Institute of Medical Sciences will conduct human clinical trials of the indigenously developed COVID-19 vaccine candidate Covaxin from tomorrow. 100 volunteers between 18 to 55 years of age will be part of the crucial trials. Healthy participants with no comorbidities and without a history of COVID-19 will be selected. People only from Delhi NCR will be able to take the trial. Corona as well as liver test will be undertaken before it. 2 doses of the vaccine will be given. There will be a gap of 2 weeks between both the doses. The vaccine will be administered through injection. The emphasis, however, remains on safety and screening, with ICMR scientists keeping a constant vigil on the matter. People can register to become volunteers by dialing the number 0742 88 47499 or mail at ctaims.covid19@gmail.com. 2 vaccines developed in India were given approval for human trials by the DGCI. Union Health and Family Welfare Minister Dr. Harshvardhan has said that with this, the fight against COVID has entered a decisive phase. Meanwhile, focused efforts of the centre and states and union territory governments on efficient clinical management of hospitalized cases has ensured that India's case fatality rate has fallen below 2.5%. With effective containment strategy, aggressive testing and standardized clinical management protocols based on holistic standard of care approach, the case fatality rate has significantly dipped. The case fatality rate is progressively falling and currently it is 2.49%. India has one of the lowest fatality rates in the world. Under the guidance of the centre, the state, union territory governments have ramped up testing and hospital infrastructure by combining public and private sector efforts. Many states have conducted population surveys to map and identify the vulnerable population like the elderly, pregnant women and those with comorbidities. This with the help of technological solutions like mobile apps has ensured keeping the high-risk population under continuous observation, thus aiding early identification, timely clinical treatment and reducing fatalities. At the ground level, frontline health workers like ASHA and ANMs have done a commendable job of managing the migrant population and enhancing awareness at the community level. As a result, there are 29 states and union territories with CFR lower than the India average. 5 states and union territories have a CFR of 0, 14 and states and union territories have a CFR of less than 1%. This shows commendable work by public health apparatus of the country. Union Health Minister Dr. Harshvardhan has launched the plasma donation drive in AIIMS with the help of Delhi Police. Delhi Police has started the campaign by donating plasma. Female officers and other senior officers of the force participated in a plasma donation drive today. A plasma bank has been set up at AIIMS to provide plasma to corona patients. It has emerged as an effective solution in treating novel coronavirus. Those who are seriously ill have benefited from it. ICMR is still researching on it, however. Appreciating plasma donors, the health minister appealed to people that those who have recovered should donate as much plasma as possible. And after 3 weeks of stricter lockdown that was put in place due to sudden spurt in COVID-19 infections, Guwahati is all set for the unlock phase from tomorrow. Assam Chief Secretary issued new guidelines for relaxations during the next 3 weeks. Relaxation will begin from 7 p.m. today and will remain in force till 7 p.m. of 2nd August in the entire Kamrup Metropolitan District, where Guwahati is located. Private vehicles, both 4 and 2-wheelers, are strictly barred from coming onto the street except for medical emergency and official duty. While lockdown norms in certain areas will continue till further notice, state government has also restricted all inter-district movement of individuals from 22nd July onwards until further orders, except for medical and last right emergencies. In Goa, streets wore a deserted look on day 3 of the 3-day lockdown in the state. Only essential services like medical stores, milk shops are allowed to function. All non-essential movement is banned except for cabs. The state has gone into complete lockdown from the 17th of July in view of rising number of coronavirus cases. The state will be observing Janta curfew till August 10th. And the administration has also imposed a ban on movement of all individuals for all non-essential activities between 8 p.m. to 6 a.m. till August 10th. And a mini lockdown is on in Uttar Pradesh from 10 p.m. Friday night to Monday morning. During this period, only essential services will be allowed. The UP government had taken a decision in the recent past to have weekend lockdown every week to contain the spread of the corona pandemic. District collectors have been empowered to make rules at the district level. And Vice President Venkaiah Naidu has hailed the media for empowering people with necessary information, analysis and perspectives about various aspects of the outbreak of coronavirus. In his Facebook post titled "Media, Our Partner in Corona Times," the Vice President dealt at length with the role of the media. Over the last few months since the virus outbreak, he complimented media for effectively discharging their core function of informing, educating and empowering people to cope with the pandemic. The Vice President noted that media played the role of a chronicler of the pandemic for use by prospective historians. Media also acted as a bridge between people and governments for regular communication on the preparedness. He further said that media also set the agenda for debates in the parliamentary institutions with analytical insights into various aspects on different sections of society. He referred to special communication campaigns undertaken by media to promote preventive measures like wearing masks, social distancing, frequent washing of hands, healthy eating, regular exercises, spiritual orientation. He also urged netizens to use social media for disseminating only authenticated information about the virus and disease and its cure instead of giving currency to misleading myths. Union Law and Communications and IT Minister Ravi Shankar Prasad has said that Digital India Today has become a transformative program whereby common Indians are getting empowered through technology. Delivering keynote address at late Thakur Prasad Centenary Memorial Lecture via video link, the minister said that the digital infrastructure in the country has helped provide a variety of e-governance and direct transfer services during the COVID-19 pandemic.
इस कोविड में हाई कोर्ट्स have conducted 1,75,000 cases virtually. 1,75,000. Subordinate courts have conducted 7,34,600 cases. And Supreme Court has done 7,800 cases. तो अगर डिस्ट्रिक्ट कोर्ट भी 7,34,600 केसेस वर्चुअल किए, ये तो बड़ी बात है. The digital power, the virtual power we are having.
The 10-day-long political drama in Rajasthan is expected to reach its climax tomorrow. Rajasthan High Court would resume hearing on the Speaker's notice against the Sachin pilot camp, which is 19 in number. The court's ruling would decide the Speaker's action against rebel MLAs and also pave the way for a special session of the Rajasthan Assembly. Meanwhile, Chief Minister Ashok Gehlot met the Rajasthan Governor Kalraj Mishra for the second time in 4 days yesterday after claiming support of 2 BTP MLAs. Chief Minister Ashok Gehlot has been claiming that he has the support of 109 MLAs, enough to prove his party's majority in the House. And Rajasthan leader of the opposition GC Kataria has clearly said that the BJP has never demanded a floor test and is not demanding one even now. He added that the party will take a decision as and when required. He added that BJP is being unnecessarily dragged into the matter.
हाईकोर्ट में जो केस इस समय चल रहा है 19 विधायकों को अयोग्य घोषित करने के बारे में स्पीकर को जो नोटिस था उस पर सुनवाई चल रही है, वो फैसला होने के बाद मैं सोचता हूँ इस बारे में कोई आगे बढ़ने का रास्ता खुलेगा। बीजेपी ने पहले भी प्रोटेस्ट के लिए न हमने मांग की, न हम अभी भी नहीं कर रहे हैं।
And let's now take a look at global updates on COVID-19. The virus has claimed the lives of over 6 lakh people worldwide, while over 1,43 lakh have contracted the infection so far. The United States and Brazil remain the worst affected in terms of infections and fatalities. The US has so far recorded over 37 lakh cases and over 1,40,000 deaths. Brazil has crossed the 20 lakh mark and recorded over 20,74,000 infections and over 78,772 deaths. Talking of deaths worldwide, the US and Brazil are followed by the UK with over 45,358 fatalities, further followed by Mexico, Italy and France. Meanwhile, the flood situation in Bangladesh continues to be grim as rivers in the Brahmaputra and Meghna basins showed rising trends in majority of the places. Over the last 24 hours, water levels increased at 18 points in the Brahmaputra basin And while in the Ganga and Meghna basins, rivers were flowing above the danger level and in 3 different areas. Several places in the country received heavy rains over the last 24 hours. In the Brahmaputra basin, Kurigram, Dalia and Rangpur received above 100 mm rain during this period. According to the Ministry of Disaster Management, floods have affected more than 23,60,000 people in 18 districts of Bangladesh, leading to the death of 8 people in the country. And England were left frustrated by the weather and faced a race against time to level the series against the West Indies after the 3rd day of the 2nd test was washed out in Old Trafford. Morning drizzles in Manchester worsened into heavy rains that simply did not relent, and play was finally abandoned. The West Indies will resume Sunday morning on 32 for 1 in reply to England's first innings 469 for 9 declared, with Craig Brathwaite 6 not out and night watchman Alzari Joseph unbeaten at 14. Opener John Campbell fell for 12 on Friday. Ben Stokes top scored in England's innings with 176, his 10th test century, while Dom Sibley hit 120, his 2nd ton. Off-spinner Roston Chase was the most effective West Indies bowler. He took 5 for 172 and pacer Kemar Roach picked up 2 for 58. West Indies won the first test in Southampton by 4 wickets. The third and final match is also in Manchester. And with that, it's a wrap on this edition of the news. News and updates continue on DD News and DD India. Namaskar.